Hi friends, it's Dr. Russ in Portland, and today we're going to do a little bit more rotational stability work. This is for anyone healing a low back injury, especially my friends on the disc healing journey. This is low impact. This is suitable for you and adaptable for you, even if you are just starting to do rehabilitation, if you're in the middle or the late stages of repair. If you're not sure where you're at, I'm going to link to a couple other videos I have on my channel educating you about this process of healing your disc, and of course you're welcome to reach out to me anytime. My contact link will be in the video description. I love hearing from you as well as your comments on the video. For this video you will need a yoga block and a fairly firm surface to work on. You're going to need about 10 minutes, and you're going to need to be gentle and careful. And I want to do my disclaimer. I'm not your doctor and I'm not with you there. So I don't know how this feels for you, and I don't know if this is appropriate for you. So please, you're using your judgments and you are responsible for the outcome here. If there is any sharp pain, if this is increasing nerve pain in your lower back, in your leg, hot spreading pain, tingling, shooting pain, please stop immediately and rest. Thanks. Let's do it. We're going to take our yoga block. We're going to put it the short way on the floor. This is the short way. This is the medium way. This is the tall way. Short way. And I'll show you first with the farther away knee, but we're going to do both sides. Place the block down. Put one knee on it. Just like that. Hands down, hands right under the shoulders, and lift your other leg up. So now the block is under my left knee. My right leg is floating. What's holding up my right leg? It's the rotational stabilizers of my lower back. The internal and external oblique, the transverse abdominal, the quadratus lumborum. Gently, slowly lower it down. Feel free to put the toe down first if you want. Take a rest. Take the weight off the left knee for a moment. Come on back. And again, lift. Feel it here in the lower part of the right abdominals for the most part. Set it down. The next time we do this, I want you to think a little bit about the supporting muscles in the thigh. So supporting muscles of the hip often are kind of checked out and disengaged, which puts a lot of strain on the lumbar spine, the lower back, and we're wanting to remove strain from the lower back. So come into your hands and knees again. And this time, as you're lifting your knee off the floor, I want you to visualize and think about those thigh muscles suctioning the hip up into the socket. The ball of the hip suctioned up into the socket, into the pelvis, and keep it suctioned up as you lower down and then relax. Again, lifting from the groin, from the outer hip, from the glute, supporting that hip in its socket, and also supporting the pelvis with the lower back and abdominal muscles. So we're able to practice and train rotational stability without putting much rotational strain through our lower back. And set it down. Awesome. I'm going to show you now what that looks like from the other side. Just moving the block. I'm going to place my right knee on the block. Hands on the mat. And I lift the left. Boom. Lower it down. Toe comes down first. Release from the hands. Come back into your hands. Now the groin muscles and the outer hip, suction that hip up and lift from the lower abdominals and the deep low back, creating a stable rotational lower back. I'm going to do two more. Lift. It's almost like the lift starts at the knee. So those thigh muscles are participating. One more time. And now if we're feeling it, we're going to add some flexion and extension challenge to this rotational movement. Let me show you that with the other leg. So you can see my free hanging leg. Left knee on the block, hands lift the right leg. So my rotational stabilizers are engaged, and as I gently swing my knee, I am asking my rotational stabilizers to keep me stable rotationally while my leg goes through flexion extension. And this is really very much what we're doing on a day-to-day basis when we're walking. So this is a very good thing to train. Keeping the thigh engaged and the hip bone sort of suctioned up into the pelvis. It's not important that we make a big swing with the leg. It's just important that we don't let that right hip sag down. We want to keep our hips level. If you want to make sure, you can look at your knees. If your knees are about even, then your hips are about even. Set that foot down, take a break, and now let's do the block back on the right side, and I'll swing my left leg for you in flexion and extension, challenging my left rotational stabilizers to keep my pelvis stable while my hip goes through flexion extension. This may be really challenging for you. That's okay. That's why we're doing it. If you can only do 1 or 2 or 3 today, then that's what you do. Come back and do it again tomorrow. You're doing real good. Let's just do a few more. And then slowly let that foot down. Release the block. That's my tip for today. Low impact, lumbar and hip rotational stability. Very crucial to restore this after any low back injury. And this is also really wonderful for preventing lower back injury. Having good awareness, engagement, ability to contract the abdominal muscles and the lumbar rotational stabilizers while moving a hip through the range of motion. I encourage you to do this daily or every other day. If you have any questions or comments, of course, please drop it in the comments of the video. Don't forget to like, subscribe, and share. Really appreciate you watching, and I hope you feel better. This is Dr. Russ.